Hello, myself, Dr. Paramjit Singh, Sandhu, MD Medicine. Today we will discuss about the heart attack, its causes, preventive measures, and first aid treatment at that time. Nowadays, heart attack is very common, especially in the stressful life, bad eating habits. Heart attack is becoming one of the most common causes of the immediate deaths and morbidity and mortality. In the past, it was thought that it occurs maybe after 60 or 70 years of age, but nowadays heart attack is very common at the age of 30 years, 40 years, and at the age of even 15 years, heart attacks are recorded. Heart is the non-stop pumping system of the body. It needs regular oxygen supply. Whenever there is less oxygen supply or whenever it is interrupted supply, then the muscle of the heart is damaged and it leads to various symptoms. And depending upon the degree of the damage, it can cause symptoms, severity of the disease, or even death of the patient. If we think of the causes, there are various factors which can cause heart attacks, and out of these, most common is the hypertension, diabetes, obesity, chronic smoking, alcoholism, family history of the heart disease, and others. Some of the drugs that can provocate heart attacks. Whatever the factors can be prevented, we should stress on these factors, and these factors should be under control. Hereditary factor is not in our hands, but hypertension, diabetes, smoking, alcohol, stressful life, medication, these are in our hands, and we should take care of these so that attacks, incidence of heart attacks can be minimized. Now, most common symptoms of the heart attacks are whenever patient feels chest pain, especially on exertion, or relieved on rest. That is the typical symptom of the heart attack. Chest pain coming on exertion or relieved on rest is the most crucial diagnostic symptom of the heart attack. Chest pain can be retrosternal, typical retrosternal. It may not be on the left side or right side or in the limbs. Typical, it is on retrosternal center of the chest, maybe with radiation to the both upper limbs or especially left upper limb. Chest pain can also radiate to the lower jaw, but it will not extend above the lower jaw and it will not go down below the umbilicus. That is the typical chest area of the heart episode. Otherwise, heart attacks can be asymptomatic or maybe painless. Then patient may feel dyspnea or breathlessness on exertion, just sweating, just feeling of kabrat. And in that case also, if doubtful, if other positive factors are there, positive provocative factors are there, then that patient should be investigated. And after that, diagnostic procedure will be carried out. Most common and first hand test of the patient is the resting ECG. That means ECG in the lying down position. Most of the times, almost 80% times, the ECG shows the symptoms, signs of the heart episode, heart attack, typical T wave changes or ST changes. And on that, we can diagnose the uh, starting of the heart attack, and depending on the changes in which leads, that can predict the area of the heart involved. And after that, various routine biochemistry tests and especially CPK-MB1 test for the damage of the muscle of the heart, and after that, maybe echocardiography. But on the bedside, ECG, clinical history is the most diagnostic points predicting the heart attack. Coronary angiography can be considered later on when patient is settled or patient is in acute emergency. Even then, angiography can be done. So these are the main investigation procedures that can be in hand in the emergency. And for the patient or for the layman, it is advisable that if the patient is having these symptoms, he can take dissolve one tablet disprin in a half glass of water and drink it before going to the doctor. That is most crucial time during which disprin will help. Otherwise, when the doctor comes and the investigations are done, then the proper treatment can be done. And in the management of the heart attack, first of all is the bed rest, investigations to know the extent of the damage. Then one group is the antiplatelet medications, including aspirin and clopidogrel, prasugrel, extra. And even if the patient's symptoms, signs, and the parameters are okay, then antithrombotic therapy can be instituted at the periphery with the specialist opinion. And after that, that patient can be referred for the angiography. And if the angiography shows some strong blockage, more than 80 or 90% in the main arteries, then it can be managed depending upon the patient's protocol. We are having stenting of the coronary vessels, or patient if young age and diabetics, and for the long-term effective measures, it is the coronary artery bypass. So these are the main salient points regarding the heart attack. But out of these, best is the preventive measures and try to control the aggravating factors, hypertension, diabetes, overweight, smoking, alcohol, regular exercise, about 40 minutes a day, 5 days a week. These are the main basis of the prevention of the heart attack and control of the provocative factors. So even if the dietary habits which include fresh fruits, raw vegetables, minimizing the fat content, these are the main problems that can be tackled. In nutshell, heart attack is commonly increasing on the society because of the stressful and high hopes living styles, which are sometimes not achievable, and then it can lead to stress and provocate the heart attack. That's all for today. Thank you very much. Thank you very much. Thank you.